Welcome back to the Now Morning Show. I am Kimberly De Souza. It is Thursday, and today is also World Kidney Day, which is celebrated every year on the second Thursday in March. So we're going to be having a discussion about the kidneys and how important they are. And right now I have with me a Dr. Bridgit Elcock-Straker, who is the consultant in Anesthesia and Intensive Care at the NWRHA. Dr. Straker, good morning. How are you?
Good morning, and thank you for inviting me.
Thank you so much for being here. Now, of course, I think we know by now the importance of kidneys, right? They can help to remove waste and extra fluid from the body. But what other uses do we have for our kidneys, and basically how important is it to us?
Right, so they make the urine, which most people know, but in addition, they regulate the balance of salts and minerals, in particular sodium, potassium, magnesium, and calcium. These are very important, one, in your bones, the calcium, and also in terms of the functioning of your nerves, your blood vessels, and your muscles. Right. So when your kidneys don't work, these don't work very well. Furthermore, the kidney has important metabolic functions in terms of activating vitamin D, so we can get better calcium absorption. Additionally, it also produces something called erythropoietin, and erythropoietin is something that stimulates your bone marrow to make red blood cells. So if our kidneys are not working, most people get very anemic, they get tired, they get dizzy, they don't feel well, they don't have energy. So very important. Yeah, bones get weak, they get puffy, they get swollen eyes, they get swollen feet, they get fluid accumulating in their lungs, shortness of breath. And it's very difficult for such persons to work, very difficult for such persons to maintain their families. So very important role of kidneys, and many people don't even know what a kidney is like. If you think of kidney beans or red beans, that's what a kidney looks like. Right. It's kidney shaped, it's about the size of your fist, and it also it lies in this area, in the flanks.
In the back. Right.
Yes, so there are two of them. So there are people who have pain, and have a back pain, must be arthritis. Make sure you check your kidneys. It could be kidney stones. There are men in particular who, we men, we don't, well, I'm not a man. Our men don't like to go to the doctor and get checkup. That's a woman's thing, as for little children. But we need to recognize how important it is to get a checkup, even if you're feeling well. No, because you may be well and in fact very sick.
Now, Dr. Straker, I was reading somewhere where I think 1 in 10 people actually suffer from kidney failure. I mean, what are some of the causes of kidney failure?
Okay, so it's multifactorial. So there are some people who have a genetic predisposition for it. There is a condition called polycystic kidneys that runs in families as an autosomal dominant, meaning if a family member has it, more than likely you're going to get it. Yeah? Even if it's only one member of your family. So it's very important in terms of knowing your family history. And some of us, we don't like to live well with our families and know who our families are. Very important to know. In addition to the congenital, there can be things like diabetes, very common cause, hypertension, obesity, high cholesterol. So these are conditions that people often do not know, and therefore we encourage people to know your numbers. So you're supposed to know what your blood pressure is, your fasting sugar. Many people don't know what their fasting sugar is, never did that in their life. Many people don't know what is their BMI, body mass index, which is a ratio of your weight in kilograms to your height in meters squared. And you should be running somewhere between 18 and less than 25. So if you're above that, if you're under that, you're underweight. And if you're above that, you're overweight. And if it becomes very severe, then you are obese or morbidly obese, and all these things predispose patients to having kidney disease. So those are the common ones. In addition, you've heard of people with lupus.
Yes.
Right? And lupus, some patients with lupus develop kidney problems, right? In addition, we have people who abuse substances quite innocently. You have a pain. What do you run and take?
Aspirin, paracetamol.
Right. So paracetamol is perhaps the one we should be taking, and in the required dose, because too much paracetamol can damage your liver, right? So paracetamol, for painkillers, many people run to diclofenac. Diclofenac comes in many forms. It may be called Divon, it may be called Olfen, it may be combined with other things, like Flamma and a whole lot of other names. And there are people who, I have a pain, I'm not going to the doctor because I'm afraid I will hear something I don't want. Therefore, I go by the pharmacy. What you'll have, you take this, it doesn't work, you go to another pharmacy, you get something else, which might be the same thing in combination with a different name. And we have had patients who've come in acute kidney injury because they have been taking multiple different types of diclofenac and end up in kidney failure. We've had people who ended up on dialysis. We've had people, there was one lady, for instance, where she was taking it to the point where it damaged her stomach. She got an ulcer. It bled to the point where her hemoglobin was down in the boots. And she almost died and ended up in ICU. And when we said, well, why are you taking this diclofenac? She had a shoulder pain and taking diclofenac for ages without getting checked out, and she actually had some sort of bone pathology.
But Dr. Straker, these drugs are over-the-counter drugs, and they're easy to purchase. I mean, could something be done about this?
Well, part of our outreach is therefore education, because education empowers people, and if you're empowered, you're then able to make really sensible decisions. So people often do things thinking, I'm helping out. I'm helping out my relative, I'm helping out myself, you know, without going to the doctor. Because a lot of people are afraid of doctors and afraid of hospitals, right? And then there are lots of good things that happen in hospitals every day, all the hospitals in the country. But in the public sector, any little thing goes wrong and they will push it and they will blow it and exaggerate it as if that is the only thing that happened in this hospital out of thousands of good things for the whole year. There are many people having babies quite successfully, many people having operations quite successfully, many people going into medical conditions and coming out well. But this is not highlighted in the media. What is highlighted is the tiny percentage where things go wrong. And things go wrong any part of the world, even in the best institutions, say the most famous institutions, right? You will have things that will go wrong. So, you know, we need to just appreciate the work that is done in our public hospitals. We need to appreciate the people who work there.
Now, how can we treat kidney failure? So we do a test or we do other things, and we have been diagnosed with kidney failure. How do we treat it?
Well, how do we treat it? Well, first of all, the test. It's very important that, okay, a lot of us go to the doctor or you go to the health center and they ask you to pass some urine. And you say, every time I come, they want urine. Why do you want urine? That's a simple screening test looking for kidney disease. Because we look for things like sugar, we look for things like protein. That's the simplest of tests. There are more complicated sticks. It's a dipstick. You dip this stick in some urine and you, oh, right, this is what is there or not there. There is a more complicated stick that looks for things like nitrites, which may signify an infection in the urinary tract. And there are other things it can look for. It can also tell you, like, if somebody's having bilirubin, which means something is going on with their liver. So the important thing is that if you do these screening tests, it may say something is wrong. Furthermore, those simple tests like your weight, a little finger prick to check your fasting sugar, that also gives you an indication. In addition, we take your family history, right? That's important. So you say, every time I come, the doctor asking me the same questions over and over. We need to make sure, because sometimes people in the heat of the moment forget that this is happening. Oh yes, my mother had diabetes, my father had, you know, high cholesterol or whatever, or this runs in our family, lupus runs in our family, or, you know, so it's important to know that. Then the next step we'll go to, after we've done the screening, the history, that screening test with the urine, is to go for blood tests. And the blood test would be full blood count. So we're looking to make sure you are not anemic. Remember, that's one of the functions of the kidney in terms of keeping your red cells healthy, right? So we look at your blood count, we look at your kidney function test, and the kidney function test looks at salts in the body, in particular sodium, potassium chloride. It also looks at your kidney parameters, which is your what is known as your BUN, or blood urea nitrogen, and your creatinine. And those are often very important in telling us where this patient is at. If these tests are abnormal, then there will be further tests. They may want to do an ultrasound of your kidneys. They may need to do a 24-hour collection of urine to see, well, how much protein is this person excreting. They may need to do check for diabetes, check for hypertension, check for lupus, right? And they also, from your history, would know, is this person taking stuff that they should not be taking? In Trinidad, we have a common problem where, oh God, I have a headache. My friend taking this.
I
have a pain in my neck.
Yes.
Let me take that too. Bad, bad, bad. Because it may be there are many different things that could cause one symptom.
Yes.
So, and thanks to Mr. COVID-19, everybody is a health expert. Yes. So we are not going to the doctor because I went online and online says X,
yes.
Y, Z.
Yes,
so
yes.
very important to respect the training and the knowledge of our health practitioners, doctors, nurses, pharmacists, etc. It's very important to respect it.
So sometimes you have kidney failure and you may lose one of your kidneys. How can you live with only one kidney, or how difficult it might be to live with only one kidney?
Okay, so we have two kidneys. Nobody knows, is one alone working or two of them working, until you lose something like 85 to 90% of the total function that you often present with symptoms.
Right.
So we try to encourage people to do the screening, do your basic health checkups, the BMI, check for sugar, check what your pressure is, check your cholesterol. Why? Because it's important to make sure that we do these things, and it guides us into coming to a better understanding.
Yes.
Did I answer your question? I think I kind of went off a little bit.
Well, in terms of one kidney, so can a person live with one kidney? And
Right.
can they live a healthy or maintain a healthy lifestyle?
So sometimes you can have only one kidney that goes bad, and the other kidney is working perfectly well. Okay. So there are people who had, for instance, a tumor in their kidney as a child, something called a Wilms tumor, and they remove one, but the other one is healthy,
right.
and they live with one kidney. There are people who have cysts or whatever on their kidneys, and they live with one. And the other thing, people give a kidney as a gift.
The gift of life.
The gift of life
Yes.
to another human, and can live with one kidney for the rest of their lives. But it's important that you have to be tested, properly screened, very, very thorough, to make sure that it is safe for you to give a kidney.
Now, is there a difference between giving a living kidney and a deceased kidney?
Yes. So a living donation is where a family member or a friend or somebody who just is a good Samaritan gives one of their kidneys to another person. So this is normally they choose, I want to give this one kidney to my son, my wife, etc. So they choose, and they can live with that one kidney. They have to be followed up for life.
Right.
To make sure that they are well, which is normally done through the National Organ Transplant Unit of Trinidad and Tobago, located at Eric Williams Medical Sciences Complex. The other kind of, so those transplantations occur at Eric Williams Medical Sciences Complex. The other type of kidney donation can come from deceased donors. And it's one of the messages that we need to get out to Trinidad and Tobago. Remember, if you're a living donor, you go anesthetic, you have an anesthetic, you have surgery. That is of no benefit to you. You're doing it as an act of love to another human being, right? But it's no benefit to you. A deceased donor is somebody who in Trinidad and Tobago is brain dead according to the laws of Trinidad and Tobago. And this is a concept that many people find hard to understand. Brain dead, what's that? Right? Because sometimes we call people who are behaving stupidly, not using their intelligence, as brain dead. They are not brain dead. A brain dead person is somebody who cannot breathe for themselves, and they cannot maintain a blood pressure and heartbeat for themselves, because there is a severe, irreversible damage to the brain. Sometimes it's a stroke.
Now, in instances like that, you can give a kidney to somebody who wants it.
So first of all, they have to be confirmed brain dead.
Okay.
So I can't just watch you and say, oh God, you're looking brain dead. No.
Right.
There is a specific thing in our laws, and we have laws regarding donation and transplantation, right? So those laws say the way in which you diagnose that somebody is brain dead. And brain dead, so it's a difference between that and a coma, because many people, but a coma, you could wake up, which is quite true. Not all people in a coma wake up, but some do. But the most important thing in a coma, you continue to breathe for yourself.
Yes.
You continue to maintain your blood pressure and heartbeat for yourself.
Yes.
A person who is brain dead, they require drugs for you to see there is a blip, blip, blip on that ECG.
Yes.
Right,
now,
and maintain the blood
Dr.
pressure.
We can go so much more into this topic, but unfortunately we're out of time. But let me just thank you so much for coming in on World Kidney Day. I think as of now we have the symptoms, we know how to treat it, and we know, of course, the most important thing is testing and knowing your family's history. So again, Dr. Straker, thank you so much for taking the time and coming today on World Kidney Day, and I know that we will have you again some other time.
Okay.
Thank you so much. We're going to take a quick break, guys. Stay with us. We will be right back on the Now Morning Show.
Thank you.